I also want to thank you for inviting me to learn about what you're doing here and to help in any way that might be appropriate. We have done a lot of work in Arizona to establish a competency-based credit area and non-credit entry, door entry community health workers in Arizona. That's called Project Jumpstart. And I forgot to bring the notebook, the guidebook, but we do have it on CDs, and I can mail you a CD of the guidebook if you want. Sarah has that. Sorry, Sarah. And I brought one more with me if you want to use it. The second part of my presentation will be on the national community of practice that brought together all of these experts, community health worker experts, consultants, college responsive faculty, etc., called Community Health Worker National Education Collaborative. That was funded by what we call FIPSE, the Fund for the Improvement of Post-Secondary Education, to the Arizona AHEC program that I was the associate director of. So I actually wrote that grant along with E.Lee Rosenthal and others, many others, and submitted it, and we were funded to establish a community of practice for college responsive programs down here. So cover those areas quickly. This is a little hard to read, but there were two FIPSE funded projects. First one was with City College in San Francisco, known as Community Health Works, the Community Health Works Initiative. And I knew that from 95 to 98. That was funded by the U.S. Department of Education. That's the foundation for the foundation's textbook. It was urban-based, employer market developed, and performance-based for the students. Employment market development was essential to this. In fact, in California, as they were developing this Community Health Works curriculum, they ended up with 3 levels of CHWs, the CHW 1, 2, and 3. I don't know whether Tim might mention that, but whether that's still in place or not. But that was an immediate career ladder development, and it happened with employers. That's where it should happen, because they're the ones that are going to hire these folks. And then that was a 17-credit curriculum, urban-based. I'm rural. In Arizona, we're a very rural state. Lots of small communities, tribal communities, Mexican border health communities, a lot of special needs populations, pockets of populations. We have a large Guatemalan group in the Phoenix area, and you'll hear about the Phoenix group in the South Mountain. We started the Jumpstart curriculum. We called it Jumpstart. I don't know why exactly, but the idea was to develop with community colleges that were interested. And we stuck rural with the rural colleges, those that serve rural communities, small communities, tribal communities, Mexican border communities, and we developed that core curriculum, competency-based and validated. This was all validated by community health workers themselves. It was informed by community health workers themselves, by employers. So it's really good that you have employers here looking at this program. So then the next thing, in terms of what we were trying to establish, was opportunity and recognition to CHWs. Credit for core competencies. Responsive post-secondary program. Responsive to the indigenous nature of the worker in the community. The non-traditional characteristics of these students. The adult students. Non-traditional learners. Standards and flexible delivery and training to meet the community health worker needs of the state. There were 4 community colleges engaged. Pima Community College in Tucson. We had Central Arizona College in Pinal County, just to the north of us. We went up into the Northland Pioneer College, which serves the tribal communities, the Navajo and the Hopi particularly. And then we also had the border. We had a community college in the border called Tuscon. And very bilingual, border specific. We assured transfer, we wanted this to be transportable and replicable to any area of the country. We wanted it to be a career progression of opportunity transferability. I talked about career ladders, but I like to talk about career lattice as well. A lattice within healthcare and human services industries. These students were able to, if they decided to go on, found out that they were just as good as any other student, regardless of the fact that they were 6th grade readers or whatever, and didn't have a high school diploma. Some did, many did. But the fact is that this was opportunity. This is the opportunity college, the community college. It's about community and responsiveness to the community. And so we believe strongly in that in Arizona. This is sort of what it looked like, the building blocks. A core preparatory course called Introduction to Community Health. And that community health work. That was the only course we developed. We also looked at those courses that might support this curriculum, but the main thing was Introduction to Community Health Work and practical experience, competency validation with employer-based, non-employers, those who were utilizing community health workers as well, but not necessarily for pay. The academic support coursework fell out in terms of first aid CPR, anyone working in a community with people, introduction to social services and communications. The communications elective was wide open. If they wanted to learn Spanish as a second language, if they wanted to learn communication in terms of computers, social service was a big supporting piece of this work. So we were actually aligned with public health and social services with the colleges. Primary health care, communication, advocacy, community health, capacity building, service skills and responsibility. Those were our 6 core competency areas. Like I said, you can do this in many ways, and we ended up with 6 modules titled this way, and that's all in the Jumpstart CD. Okay. Here are the recommendations made by the students. Keep them small, allow for adequate time. Faculty do skits and role plays, include assignments with individual presentations. The students became the teachers, and the teachers learned from the students how to teach and what to teach. Keep it upbeat. Include multiple agencies, legal issues and documentation skills, obviously very important, and teach boundaries for the community health work. Lessons learned was seek and ask for help to raise the college's awareness, share your knowledge and experience, skills for life, believe in yourself, have fun, and never quit, and balance your time, prepare for intensity of study, plan, budget, daycare, financial aid. This is what the students said. These were the things that they recommended to their peers who were going to take this program. These were important issues for them. Now, the community of practice was the CHWC, the NEC program, and that again was best principles, best practices, and providing some technical support across the country. It involved 6 core technical institutions: Minnesota, Oregon, Connecticut, Arizona, California, Texas, and the National Advisory Council, most of which were community health workers themselves. We worked with Dinek College Diné College means Navajo. The Navajo people are the Diné people. And they don't necessarily like to be called Navajo, okay? And then these other colleges were adapted. These are the folks who were the leadership. These are community health workers. And then we had CDC involved, Health Education Training Center Alliance involved, Center for Sustainable Health Outreach, and Indian Health Service. Sergio was a coordinator, international coordinator of the Caribbean program. Sarah Redding has been mentioned, Carl Rush, Cindy Sy of California, and Ann Whitthorne. Ann Whitthorne helped us develop a competency by assessment for students to be able to enter the program and be given credit recognition for the competence they brought to the program. So my time is up, but I'm not going to be able to go through all of this, obviously. But the typical feasibility study that a college goes through was essentially these things. And key considerations were the outcome of this project. These were informed by the community health workers, promoters, the CHRs, etc. These are the key considerations that the council developed. And you can contact us. I'm at the University of Arizona. I'm retired, just retired a week ago. And last week was so busy. And the website, I wanted to say the website, CHW NEC website, it has not had enough attention recently, and I've been asked to, in my life in retirement, to help connect that with all of the projects and programs going on across the country. It will be a much more useful site in the very near future. So thank you very much.